my pleasure and privilege to talk to you about personalised care, a major conceptual change for our NHS, introduced in January 2019 within the NHS Long-Term Plan. Personalised care, or PC, aims to transition our healthcare system from the current paternalistic framework to a person-centred approach, no longer asking individuals what's the matter with you, but rather seeking to resolve the more holistic question of what matters to you.
This is a human being. He's got a face, he's got wrinkles, he's got eyes, he's got kind of half a smile, and he could be any one of our patients. So we've got him, and now let's look at us. This is the NHS. Hard work, isn't it? Yeah, it's a absolutely massive oil tanker with so many component parts, and everyone's doing their bit, and it works. Despite all the doom and gloom, we've got an absolutely fantastic health service, but it's hard to navigate. It's hard to know where the person actually fits in that, especially when we've got now targets and QOF and other things which are more about standardization of care. So it's about doing the same thing for everybody, not tailoring your healthcare to that individual. The most common long-term health condition is multiple long-term health conditions. If you've got type 2 diabetes, you only got 15% chance of just having type 2 diabetes. You've got a 50% chance of having 3 or more long-term conditions. But our clinical studies are usually based on highly selected groups. And these are the top, most highly prescribed item groups for 2018. Number 1, lipid-regulating drugs, basically almost all is statins. Then you've got the antihypertensives, antidepressants. The next group is largely PPIs. And then you've got painkillers, and you've got diabetes drugs. Why are we prescribing so much stuff? When you look at the numbers needed to treat, there's a great website called www.thennt.com. I'd recommend you have a look at it if you haven't seen it already. For too long now, we've been doing things to people. You will have your urinary ACR repeated in 2 months. You will do this, you will do this, you will do this. If we're a little bit kind, we might start doing things for people. Oh, I'll do a referral for you. It's a bit better. But a step ahead is, let's co-create a plan together. Let me do something with you. Let's agree a plan together. That's a step ahead. And a step ahead of that is when we enable people and communities and families and our practice population and our patient population to feel the knowledge, the confidence and the skills to actually be able to do things for themselves. It's about co-creating services. So the ethos of person-centered care is care that is personalised, coordinated, enabling, and people are being treated with dignity, compassion and respect. And then they're going to say, well, okay, does it work? Yeah, of course it works. This is just data from our little project in Handsworth. We just did a one-off consultation with people, and even 12 months after they've had a one-off consultation about what matters to them, setting some goals, getting in some social prescribing, just getting them involved in some community activities, they're still seeing their GP 30% less, even after 12 months. So it's like riding a bike. Once you're empowered to be able to do it, the effect lasts. This is HbA1c readings, and it's quite small on the screen, but the big blue chunk is the people whose HbA1c readings reduce, so their diabetes, type 2 diabetes control improve. And the green wedge is the people whose HbA1c reading has come down out of the diabetes range and back into normal range. So they've been I've had type 2 diabetes for, in some cases, 10 or 15 years. And after one appointment, they're no longer diabetic. Shared decision making works, man. There's so much evidence now. It's new service reviews and things are coming out all the time now across the country because this has been rolled out since last year and well before that as well. It's a win-win. Well, it's win-win-win. It's best. It's good for patients. It's good for staff, and it's good for the health service.
Join the conversation and learn how we can all engage in shaping the exciting next decade of our NHS.